Welcome to my Guardian Home Care YouTube channel with new video about common medications for seniors, what every caregiver should know. Let's start. As we age, our health needs change, and with that, so does the number of medications we take. For many older adults, managing multiple prescriptions becomes part of everyday life. But with so many pills, doses, and names to remember, it can quickly become confusing, even overwhelming. In this video, we'll walk through some of the most common medications prescribed to seniors, what they're used for, and what caregivers should watch out for, from side effects to interactions. Seniors often take more medications because aging bodies deal with more chronic conditions, like high blood pressure, arthritis, diabetes, and memory loss. According to health studies, nearly 90% of adults over 65 take at least one prescription, and over 50% take 5 or more. This is called polypharmacy, and while it's sometimes necessary, it also brings risks. 1. Blood pressure medications. These include ACE inhibitors, beta blockers, and diuretics. They help control high blood pressure, which is very common among seniors. Examples: lisinopril, amlodipine, metoprolol. Caregivers should watch for dizziness, fatigue, and swelling in the ankles. 2. Diabetes medications. For seniors living with type 2 diabetes, medications help control blood sugar levels. Examples: metformin, glipizide, insulin. It's important to watch for signs of low blood sugar, shakiness, confusion, or even fainting, especially if meals are missed. 3. Pain relievers and anti-inflammatories. Pain management is a big part of senior care, especially with arthritis or back pain. Examples: acetaminophen, Tylenol, ibuprofen, Advil, naproxen. However, long-term use of NSAIDs like ibuprofen can cause stomach issues or kidney problems. Always follow dosage instructions carefully. 4. Medications for memory and dementia. In early stages of Alzheimer's or dementia, doctors may prescribe medications to slow down memory loss. Examples: donepezil, Aricept, memantine, Namenda. While these don't reverse the condition, they may help with daily function. Be aware of possible side effects like nausea or unusual dreams. 5. Sleep aids and anti-anxiety medications. These include medications for sleep disorders or anxiety, but they must be used with caution. Examples: lorazepam, Ativan, zolpidem, Ambien. These drugs can increase fall risk, confusion, and dependence. Always talk to a doctor before using these regularly. With so many medications in play, medication management becomes critical. Missed doses, drug interactions, or duplicate prescriptions can have serious consequences. That's why every caregiver or senior should use pill organizers, maintain an up-to-date medication list, and consult with pharmacists or doctors regularly. Every 6 to 12 months, ask the doctor for a medication review. They may reduce unnecessary prescriptions, check for harmful interactions, or switch to safer options. Don't be afraid to ask, "Is this still necessary?" or "Can we simplify this?" Medications can improve quality of life, but they also require careful attention. Understanding what each pill does, why it's prescribed, and what risks it brings is the first step in keeping your loved ones safe and healthy. Whether you're a caregiver, a nurse, or a senior yourself, education is the best medicine. Managing multiple medications becomes even more delicate when a senior is taking more than 7 pills a day, which is common in older adults. At this level, doctors often recommend adding a stomach protector, such as omeprazole, to reduce the risk of stomach irritation or ulcers. These small preventive steps can make a big difference in comfort and safety. When it comes to pain management, particularly after surgery or for chronic pain, opioids may be prescribed. But these medications often lead to constipation, a side effect that's not just uncomfortable, but potentially serious. To help manage this, doctors may prescribe laxatives or stool softeners such as Mavacone or lactulose syrup, which help restore balance and comfort in daily life. If this video helped you, please like, subscribe, and share with others who are caring for a senior loved one.